Hi, this is Dr. Andrew Lovy from the Paley Institute. We've got a really exciting case to show you today. We have a gentleman who cut his small finger and unfortunately didn't seek treatment right away. So we were unable to repair his tendon primarily to restore his ability to bend his finger down because it was so scarred in the first time. We had to put in a silicone rod going from the fingertip down into the forearm here to recreate that tunnel and sheath that the tendon travels through. We also tied two tendons together, the two tendons that are to the small finger. We tied them together in a loop here in the hand the first time in there to use a technique described by Paneva and Lovy. And by tying those two tendons together in a loop, we're going to then come down into the forearm. We're going to cut one of those two tendons to flip the tendon back through over to here, tie it into that rod, pull it down into the finger, down to the tip, tie it in there, have him make a fist again. Sounds kind of crazy. It is a fun, cool case, and hopefully we'll see if we can get this guy a strong fist again.